There we go. Welcome, everyone. Thank you for joining us for today's webinar. Connect with the campaign for grade level reading on social media. On YouTube, subscribe to our channel at Grade Level Reading. On LinkedIn, Facebook, and Instagram, follow us at Campaign for GLR. And on X, follow us at Reading by Third. Please use the hashtag Learning Tuesdays to share anything you learned from today's conversation, and we will be sure to reshare. We encourage you to post any questions, reflections, or observations on social media. My name is Sierra Sanchez with the Campaign for Grade Level Reading, and I'll be working behind the scenes to produce this webinar. Before we start, I just wanted to take a moment to acknowledge our enterprise and our programmatic funders, as well as our individual donors. Your support not only allows us to hold these vital conversations, but also helps us create meaningful connections, build opportunities to share insights, and build the GLR community. Thank you. I also want to give special thanks to our Leo sustaining sponsors, who you can see on this screen here. Thank you to our Leo sustaining sponsors for making these GLR Learning Tuesdays conversations possible. As we get started, I have just a few housekeeping tips. First, we would love for you to introduce yourself. So please use the chat box to share your name, city, or state, and your organization. Be sure when responding to select everyone so that we all know who is here, and feel free to share your thoughts and insights throughout the duration of the webinar. All attendees are in listen-only mode, so we encourage you to post any questions that you might have in the Q&A box. Our panelists will be typing out responses to those questions as we go through the conversation, and they will have a few moments at the end of the webinar to respond to questions live. The webinar is also being recorded and live streamed on Facebook. The link to the recording, as well as all slides, bios, and resources, will be shared in a follow-up email to all who registered. And lastly, we hope you will join us in taking our brief evaluation poll towards the end of the conversation. This helps us with our commitment to continuous improvement. And lastly, before we jump in, I just wanted to call your attention to some of our upcoming webinars that we have through the end of the year. Next week, we hope you'll join us for our final live session of 2025. This will take place on December 16th from 3 to 4:30 p.m. Eastern Time, and will be co-sponsored by the Thomas B. Fordham Institute with Reaching Their Full Potential, Plugging the Leaky Pipeline for High-Achieving Low-Income Students. Then during the holiday season, we will be having some special rebroadcasts over on our YouTube channel. Those will take place at 3 p.m. each Tuesday as we at the GLR team take a little break. These will be some of our most popular sessions from throughout the year. And like I said, those will take place over on our YouTube channel. So more information and registration links will be posted in the chat box now, including those special holiday rebroadcast registration links. And we hope that you can join us. And joining you now is Michelle Hyman with the Campaign for Grade Level Reading. Thank you and enjoy.
Thanks, Sierra. Good afternoon, everyone. So on behalf of the Campaign for Grade Level Reading, I'm really excited to welcome you all to today's session, Healthy, Present, and Learning, Cross-Sector Strategies to Reduce Health-Related Absences. Thank you for joining us for this important conversation that's going to examine the intersection of health, attendance, and learning. The Campaign for Grade Level Reading is pleased to co-sponsor today's session with AttendanceWorks, an organization with whom we've had a long and valued partnership dedicated to ensuring that children are present, engaged, and on track for school success. Today's webinar builds on that shared commitment as we turn our focus to one of the most significant barriers to regular attendance, health-related absences. So we'll hear from the authors of a new collaborative toolkit developed by Johns Hopkins University, AttendanceWorks, National Association of School Nurses, and Healthy Schools Campaign, as well as from practitioners implementing key strategies in their communities. It is now my pleasure to introduce our moderator, Hetty Chang, Executive Director of AttendanceWorks, who will guide us through today's discussion.
Thank you so much, Michelle. Truly, the Campaign for Grade Level Reading is an invaluable partner for us. The campaign has long recognized that attendance is foundational to early learning, to laying the groundwork for future success in schools. And we've so appreciated the partnership because it always helps people understand the why we need to have kids show up every single day. I want to go to the next slide and talk, though, about the current reality is that, unfortunately, during the pandemic, chronic absence nearly doubled, and it still remains too high. Um, Even when you start to look at, it went to almost 30% of kids, almost 1 out of 3 kids. It's still close to 1 out of 4. Might have gotten a little better, but it is far more elevated than it ever was before the pandemic. And if you go to the next slide, you can see that this chronic absence starts high among our youngest learners at a critical time when students are developing connections to peers, developing their social emotional as well as their academic skills. And this chart, this kind of Nike swoosh, um, really shows the reality that we have to start to address chronic absence as early as possible, ideally in preschool and kindergarten. And if you go to the next slide, what we know is that the key to improving attendance and reducing chronic absence is finding out and addressing what causes kids to miss school. Is it barriers? Is it aversion? Is it disengagement? Is it misconception? Health-related challenges actually cut across all of these big buckets. And this is why I'm so pleased to be able to have today's webinar, where we will first be able to hear about this forthcoming toolkit that we are so excited to produce in partnership with Johns Hopkins Center for School Health, the National Association of School Nurses, the Healthy Schools Campaign. This is going to be really, I think, a key tool to help people take immediate and long-term steps to improving attendance. And with that, let's go to the next slide. I'm going to introduce authors of this report. Dr. Elliot Atisha, who is the Senior Fellow for Health with Attendance Works, Beth Marshall, who is the Associate Director of the Center for Adolescent Health at the Johns Hopkins University in Baltimore, and Kim Stanislaw, who's the Chief Clinical Officer for the National Association of School Nurses. Together, our team here of Elliot, Beth, and Kim, they're going to take us through the why and the what of this toolkit. I'm going to start, though, by asking the why. Why does preventing health-related absences matter more now than ever? Elliot, will you start us off?
Will do. Thanks, Hetty. Hi, everyone. So, especially post-COVID, we are seeing a rise in behavioral health issues, including anxiety and depression, both of which contribute to a significant number of missed school days, reinforcing that school attendance is a public health issue. Health disparities disproportionately affect economically disadvantaged students, and if we leave those unaddressed, then these health issues impact a child's ability to show up to school and then only further widen the achievement gap. And the earlier we intervene in identifying and addressing their health issues, the better the outcomes. Many students don't attend school because they don't feel safe or they don't feel connected. And if we look at youth risk behavior survey data, roughly 40% of adolescents just don't feel close to others at school. And where does that leave motivation to attend? And these same students are missing out on building routines and support systems, which then only puts them at further risk for poor health. And so ensuring that our students feel connected can really help serve as a powerful buffer against such negative health outcomes. And I'm going to hand it off to Beth so she can talk about why we must take a systems-based approach to addressing health-related absences.
Thanks, Elliot. To echo what Elliot and Hetty just mentioned, mental and physical health challenges are a common contributor to chronic absence. And some research in New York City showed that when families of chronic absence students were interviewed, over half of the absences they attributed to health-related causes. But when we think about some of those root causes under those health concerns and mental health concerns, they're often include limited access to healthcare, housing instability, family stress that arises because of some of these broader health issues. And these are not things that are originating in our school buildings. So it's really important that we think about these as challenges that schools aren't left alone to address, particularly in our post-pandemic time when Schools have academic recovery to worry about, increased staffing pressures, increased student need. Um, so if we want to think about like sustainable solutions, we need school systems and healthcare systems and community organizations to work together and acknowledge that this isn't just a school or an education issue. I'm coming from a public health background. If we want to just advance the slide, one slide, we came together this summer in DC to stress a public health approach. So we brought together partners across health and education systems to think about an approach that leverages health and education systems to think about individual and population level data so that we can use that data to guide our collective action, that we're engaging in new cross-sector partnerships, and that we're really facilitating a shift from, reactive responses to more proactive and prevention-focused strategies. And the toolkit integrates this public health approach and builds on a lot of the work that the organizations that are involved have previously done.
Thank you, Beth. So I'd like to turn to Kim for a moment. Kim, at this moment, what are you seeing as some of the most common health-related absences causing kids to miss school, young kids to miss school?
Thank you, Eddie. There are many reasons for absences, particularly related to health, whether they be acute or chronic issues, namely asthma, oral health, and as Beth and Elliot both mentioned, mental and behavioral issues, the social determinants of health. But we also have seen through some of our work that there are many students absent for health reasons that go unknown. They're undiagnosed health conditions, and parents may not be able to verbalize the symptoms, conditions, or the needs when reporting their child absent. And so without a specified reason, these students are more likely to go through the truancy route rather than the health supports. And I'd say this problem is also multifactorial. So when we talk about more the systems level reasons why students are absent related to health, health and academics are intertwined and they can't be separated. And we have seen since COVID a lack of clarity on when students should or should not stay home for health-related reasons. So one of the things we need to do is have a language shift. So we have worked, and NASN has worked very closely with Attendance Works to create resources on helping parents understand and students understand when is too sick to not be in school, kind of reversing the message. But there's also a language shift we need to look at for our school teams. Through our work with the CDC, looking at chronic absenteeism, our new path forward is that all absences are health-related until determined otherwise. And again, we go back to that idea of those undiagnosed health conditions. And many of those are just very hard to verbalize. And we miss many of them when all they're looking for is some support and referrals.
Kim, I want to just check on this one. There's both the issue of if you start with health, which is what, as Beth said, most families say my kid missed because they had a health, but they were sick. I think that was a little bit true before the pandemic and even maybe more so now during the pandemic. But it seems like you have two challenges. There's both when is too sick to be in school, but when are you really not so sick that you should miss school? And what Elliot was talking about was those anxiety related issues, which often manifest as stomach aches and headaches. So are you also seeing that families are actually missing school when they don't need to miss school?
Oh, absolutely. And, there are, again, many reasons. Some of them are social, some of them are behavioral, but it can be very hard to determine if the symptoms the student is reporting are somatic or they're related to some other acute or chronic condition. And as a parent, as one of my children came home today, um, it can be very hard making those decisions. And it can sometimes it's easier to keep them home, um,
And this
than
may
cause
speak
more
to
fight.
why the importance of that systemic approach that Beth you mentioned, because when we can talk to a health practitioner and ask for their advice, it might, I'm thinking of the examples and we'll hear them more later on, but of, just take your kid to school. I'll check them out. If they need to stay home, they'll go home. But if you know that there's someone who knows what's happening, you might be more likely to take them to school because either they can get treated immediately or you're assured, hey, this is okay. I want to shift now a bit to these toolkit. Can you tell us what the strategies are? I think you have four key strategies. Can you give us a little bit of an overview of the strategies and then start telling us about each one of them? And I think this is you, Kim. Yeah.
Sorry, on the wrong slide. First, healthy students are better learners. When students are healthy, they're more engaged, they stay focused, and they perform better academically, which results in improved academic and health outcomes. And it starts with prevention. Making sure our school policies and protocols
Can
are
I
in
ask,
place.
Kim, just if
Yes.
the campaign could pull up the slide so they could see all of the toolkit strategies, that would be great. I think it'll just make people a little bit easier to follow what we're talking about. So thank you.
So with prevention, we look at school policies and protocols to make sure that they're evidence-based and they promote students staying healthy and engaged in the classroom. And when thinking in terms of tiered interventions, identifying health as a priority is a foundational support. And this includes the presence and active engagement of a school nurse or other support services personnel to identify and support student and school community health needs. Um, this may also include health screenings, general health education, access to healthy food, after school and enrichment programs, and promoting healthy relationships. Those healthy relationships build trust. Parents and students are more likely to share information when there is a trusting relationship. And then they are more likely to feel supported, engage in school, and show outcomes of better emotional well-being and motivation to be in school. And school nurses are often the first and last line of defense for student engagement. And when we build those trusting relationships and approach chronic absenteeism with how can we support you from a trusted team member, then that goes a long way in addressing the health of both the students and the families. I'm now going to hand it off to Beth, who's going to discuss messaging.
Thanks, Kim. So on the slide, you're seeing 3 of the 4 toolkit strategies. We'll flip and we'll get to the 4th one in just a bit once we've had a chance to talk through these first 3. And the way the toolkit is set up, each of the strategies really focuses on the school level, the district level, district partners like our local health departments, and then the state level and their partners as well, thinking about the state health agencies. So in terms of messaging, Hetty mentioned the excellent resources that have been put together in terms of providing sort of consistent guidance for families and schools so that they can support decision making in terms of when you keep a child at home. And I think those resources are linked in the chat. Ideally, those type of messages that come from the school are consistent with the messages that are also amplified in the community. So through local healthcare providers, through our local health departments, even through community partners like faith-based partners, like really echoing the messages sort of across the community. And ensuring that the messaging that's provided is really focused on a positive portrayal of why it's important to be in school, not necessarily what you miss by not being there, right? We really want to focus on the positives of why school is important and beyond just academic benefits. And I know that, as educators, right, our focus is going to be on academics, but research with parents has shown that it's much more effective to talk about the whole child in terms of messaging. So both the social and emotional benefits of being in school every day. Ideally, also, messages are culturally appropriate and tailored to your local community, and also delivered when possible by a trusted person. So I know we're all probably very experienced, both as parents and as educators, of the text-based systems to identify absences. And sometimes that goes sort of out generally to everyone, and sometimes you get more specific messages for those who have additional absences. And some of the research has shown that those additional follow-ups are helpful when they come, directly from your child's teacher or the community school coordinator at your child's school. So someone that a parent, has a personal connection with. And I just also wanted to touch on a couple other resources that are linked in the toolkit. And one, everyone has talked about sort of the increasing presence of behavioral health issues, and particularly anxiety in our post-pandemic world. And the American Academy of Pediatrics has developed some tips for concerned parents in this sort of area of school avoidance when it comes to anxiety, that are also really helpful for parents. And again, a place where messages should be consistent across the school and our community partners. And the last resource I wanted to share was that the Ad Council released a toolkit last year that is focused on messaging around chronic absence. And, some of the things that we've already discussed are really present there in terms of ensuring a whole child approach, ensuring that messages are positive, that we're using trusted messengers. And the other piece that they talk about is really stepping back from jargon. And I think sometimes when we talk about chronic absence, we talk about this sort of 10% number of the school year. And I think it's been shown really clearly that for parents, like, give me a number, don't give me a proportion of the school year. So just making our messaging as clearly as possible. And I'm going to turn it over to Elliot to talk about identifying health needs.
Thanks so much, Beth. So we really have to first understand the health and social needs of our students and the communities we're serving. And this requires collecting and analyzing attendance data along with the health information so that we can better identify disparities and specific patterns. We have to also make sure that our attendance data captures specific reasons for missed school days. If we conduct health needs assessments and use health screenings, we can help identify health-related barriers, some of the more common health-related reasons why kids are missing school. And it's identifying barriers that is the critical first step to addressing them. Which of our kids has asthma? Do those same kids have an asthma action plan? Do they have access to a rescue inhaler if their asthma acts up at school? Is the family dealing with housing or food insecurity? Hetty and Kim talked about headaches and stomach aches possibly being due to underlying anxiety. over the years, if I could only tell you how many times I also walked into a nurse's office and saw a child there with similar complaints, but the underlying reason was because of food insecurity, and giving them something to eat helped them get back to class. And on the next slide, we're gonna start to discuss what collaboration looks like, the fourth strategy of our toolkit. We're first going to start, though, by playing a short video that provides a nice example of attendance teams in action, and making sure to include those individuals, the right individuals at the table. And Hetty's going to lead us off in that video.
It's not necessarily targeting individual kids. It's targeting when there are patterns present in your school community that are affecting large numbers of kids.
Talked to this kid's actually, and he is doing a lot better as far as getting to school. He's at 94% attendance.
I think the biggest systemic change was putting the attendance team together.
So devise the plan and then follow through. Get the right people on the team who can move the plan.
Trust is one.
And then make sure you follow up.
Our attendance team consists of our attendance clerk, our truancy officer for the district, the teacher on special assignment for our school, and our school psychologist.
Good morning. Hi, Bridgewater.
Ours includes social workers, admin, and our student support person. And so then that expands to investing teachers who might have a relationship with the child to do the home visit or to do the outreach.
When I said I needed an attendance team, we needed to be able to work together on attendance, then everybody wanted to, join in. The nurse said, I'll do this. And the counselor said, well, I can do this. So that's when my nurse got in it, and she started saying, well, I'll call parents and just let me get those that are missing or absent, and I'll start calling. We'll see what's going on.
Holiday joy.
Awesome. All right, so I'm going to hand it back to Kim and Beth so they can provide an overview of the attendance team and the importance of prioritizing health in those conversations.
Thank you, Elliot. And as we just saw in the video, chronic absenteeism, like most other issues in schools, cannot be addressed without a team. And attendance teams really need to take a whole child approach. Coming from the health perspective, remove stigma and negativity around the absence, again, that trusting relationship, and coming from how can I support you rather than why aren't you here? And as a team, we're all there for the same outcomes, that students are healthy, safe, and ready to learn, and they have, they're doing well, they graduate. We all work towards the same academic indicators and outcomes. So if we work from one plan, not a wellness plan, a behavioral plan, a general school improvement plan, if we work from one plan and have whole child interventions, we set ourselves up for multidisciplinary teams that address not only the whole child, but also a whole school focus. And most importantly, we need to ensure that there are school health professionals on attendance teams. The interventions cannot address a whole child unless there are qualified representatives for each component. And as we've heard throughout the discussion so far, health is a large reason for chronic absenteeism, whether it's diagnosed or undiagnosed. And you really do need that health perspective for the assessment of the students and supplying referrals and supports. And on these attendance teams then that are multidisciplinary, the roles of each member need to be clearly defined. And school nurses for the health part, as well as local healthcare providers, bring valuable expertise. We have this expertise in understanding, identifying, and addressing student health needs, as well as the underlying root causes, communicating with families with those trusting relationships, and advocating for supports and resources, in addition to promoting healthy habits. So I am now going to turn it over.
Thank you, Kim. I'm going to just tag on to that for 1 second just to talk about sort of like agency level collaborations as well. Hetty started the video talking about a focus on patterns and really thinking about groups of young people in your school building versus individuals. And I think often to take that sort of like larger view and whole picture view of the school and the patterns that you're seeing, it's often helpful to have those health representatives that are in the school. I see lots of folks in the chat proudly saying that they're school nurses on their attendance team, which is amazing. So also thinking about the other health professionals in the building who might be able to be a part of teams. So that might be school social workers, other members of the student support teams. And then, as Kim mentioned, also thinking about community healthcare providers. So local healthcare providers who are serving a lot of your students are also sort of great to connect with attendance teams in the building. And then thinking about that, like as we sort of move up to a district level or thinking about that at the state level and ensuring that we have those representatives at the district level working together. So we've got school district folks focused on attendance, but we also have the health department focused on attendance as well. I saw some folks in the chat saying that their messaging comes from their local health department, which is great. So as long as those messages are coming from the health department and are being echoed by the school, we love like that level of collaboration across those teams and agencies.
Thank you so much. So we want to explore one more issue before we sign off and go to our incredible panel of practitioners. And there are really two questions here. One is, why is that collaboration that you're advocating for so hard to do? And then the second question is, and so what can we do about that to improve the collaboration? Let's start with a little bit naming the challenge, because sometimes you got to name it in order to solve it. Elliot?
Yeah, thanks, Hetty. So one challenge is that we don't always have a clear understanding of the root causes that drive chronic absenteeism. It's that slide that you showed earlier, Hetty, highlighting the different buckets. And this can make it difficult to ensure the necessary supports, resources, and interventions are in place. And understanding the root causes will allow us to identify the right partner to address it and ensure that those supports and resources are available. Health and education sectors have also historically operated in silos and tend to be driven by different priorities, which can make it difficult to align and coordinate goals. And it may also be related to challenges with information sharing. I'm going to hand it off to Beth so that she can discuss this further along with some of the additional challenges that come with collaboration.
Thanks, Elliot. I want to highlight both something that you said and Kim said earlier. When we think about like the priorities alignment, when we think about health and education, certainly like we want to see positive health outcomes for young people from a healthcare perspective. Education, we want to see, positive academic outcomes, but across the board, right? We want young people to thrive. And sometimes language separates us. Sometimes it's the fact that everyone has to have their own improvement plan. That is, not always sending us all in the same direction. So that collaboration, when we're thinking about community needs assessments, when we're thinking about school health, school improvement plans, that we're not having separate, we have a separate program for wellness, we have a separate program for health, we have one for school improvement, but we think about how we can sort of align. And then one of the other challenges, I'm sort of shifting gears, that Elliot briefly mentioned, when we're talking about going back to the patterns and looking at what is happening across our school with young people, often we have access to different types of data. And sometimes it is challenging for us to share data across whether that be the school health team and the attendance team or outside health providers. So there's a lot of work that I think folks have put into thinking about how we can make the Health Information Privacy Act work with the Education Privacy Act. So there are ways for us to collaborate together. And when we're on the same teams, I think that really helps us think about how we can accomplish information sharing.
Great. I'm going to see if Kim wants to add, and then I'm going to just give you a warning, you all. We're getting really close to the end of the section. So I'm going to turn at the end to ask you what works. And I'm going to ask you each to just talk about one idea. So you're going to have to pick one off the many I know that are in your heads. But Kim, what would you add to this list of challenges?
I think from my perspective, the biggest thing to add is we've talked about and we've promoted this team approach and addressing it from the whole child approach. In reality, that's very difficult, as not all specialties are typically present in all schools or at the same time. And this often leads to addressing some of these issues in silos, which actually leads to duplication of work and inefficiency in utilization of resources that are typically harder to come by, such as staff time. So we do see that although it's the goal, we have some work to do, but we can get there.
And I will say that one of the folks put in the Q&A, just noticing it, about how they have 60 students visiting per day, you know, for these school nurses, how the challenges of having school nurses who might even have multiple schools. You have 2 days a week for psychologists and social workers. So this issue of staff time, and maybe at the end, we'll come back to even a discussion of what do we do about that fact that we don't have that capacity. But if you have any of you, if you were to say your top strategy for addressing some of these things, what would you say it would be? Elliot?
Sure. So, I mean, we really need to make sure that health is a priority, and having the right infrastructure, the foundational supports in place. And that includes what Kim just mentioned, you know, adequate staffing of school health service teams. Because if you have these individuals in place, that's going to lead to improved collaboration and coordination, not just at the school level, but in partnership with public health departments, healthcare providers, community organizations, and these partners can help schools and districts better understand the broader social environmental factors that impact student health and attendance, and then provide the necessary resources and supports to address them. None of us can do this work alone. It really does take collaboration.
And Elliot, I'm just going to put out, one of the webinars we did was with Washington. This is Attendance Works, where they had actually changed the funding formula so that you increased, as a part of the basic funding formula for schools, the amount of money that could go to school nurses, to social workers. So some of this gets to that. Yeah. Beth, what would you add?
I would focus on data. I think that schools tend to be a place that have a lot of data and don't always have the teams in place to analyze that data, get it to the right people so that we can act on it. So I think taking that sort of collaborative approach to the data that's available, minimizing additional data collection, but really figuring out the teams to use the data that we currently have available and to be able to act on it quickly, I think is the strategy that I would highlight.
All right, Kim, what would you most emphasize here?
To build off of both of what Beth and Elliot said, you know, and particularly the data, our policies and practices need to be evidence-based. So they need to be based on the data that we're collecting, as well as the data and evidence from research. For example, we know that school nurses keep kids in school. If we want to create a healthy learning environment, then every school should have one.
Thank you. All right, Beth, and we're going to the last slide. You actually get the last word here. So for those who want to get access to the toolkit, how should they do that?
Yeah, so Toolkit should be out around mid-January, and you will find it on the Center for School Health's website. This QR code will take you direct to it. The link is here in the slide as well, and this will come out to everyone after the webinar. Currently, there are a lot of other attendance resources there, some from Attendance Work, some from National Association of School Nurses, from the Healthy Schools campaign, and then the All In for Attendance summit that we hosted this summer in DC. You'll have access to all of that at that website now while you're waiting for mid-January.
Thank you so much, Beth. Beth and Kim and Elliot will come back at the end when we open for Q&A. So it's goodbye for the moment, not for the entire webinar. So we look forward to hearing from you again. But right now, I have the pleasure of introducing our panel of practitioners. We can move to that slide, who will kind of talk to us about what does this look like in reality. And I also want to acknowledge, as I'm doing that there's an incredible amount of knowledge in the almost 600 people who are here on this webinar with us. The chat and the Q&A are all well worth paying attention to. With that, we have this amazing group of colleagues to talk about what this looks like in reality. So Christy Granillo, who is the manager for community health, worker integration with Loma Linda University Health in California. Joey Millwood, the director of student services with Hall County School District, Georgia. He's going to be joined by Joy Schofield, who is the Dialectical Skills Group Developer Coordinator and Trainer for Hall County School District, Georgia. And we also have our principal here, Principal Hannah Sam with Kingsbury Elementary School in Waterbury Public Schools, Connecticut. And we're actually going to start, we're going to ask each of Hannah, Christy, and then Joey to talk a little bit about their communities and what they've seen in terms of reductions in chronic absence. And we're going to start with Hannah. So Principal Sam, we are so glad to have you here. And why don't we go to the next slide? And can you tell us a little bit about your school and what you've seen around chronic absence?
Good afternoon, everyone. I'm Hannah Sam, principal at Kingsbury School. I have to tell you that I've been in education for over 20 years, serving as a teacher, a building coach, an international baccalaureate middle years program coordinator, and currently serving as a principal here in Waterbury Public Schools. This is my 5th school year in Waterbury Public Schools. I do serve a school population. We have a school population of 418 students at Kingsbury School. 59% are Hispanics, 29 Blacks, 5% 2 or more races. We have 4% white and 3% Asian. In addition to this number, we do have 18.3% of our students who are multilingual learners or English language learners, and 23.6% being special education student. If we can go to the next slide. I did share this slide data in comparison with our district and also the state of Connecticut. So you can see Kingsbury is in blue, the state of Connecticut is in gray, and also our school district is in yellow or gold, as you can see. So as far as our chronic absenteeism rate, as you can see, I started with 2022, 2023, but what is not here is our data for 2021, 2022, which was 38.7%. Prior to that, it was 46%. And so from 2022 to 2023, you can see we decreased our chronic absenteeism by 5% to 33.7, and then to 26.8 at the end of June 2024 to 26.8, which is 6.9% decrease. At the end of June 2025, we decreased it to 23%, which is a 3% decrease. And so from 2021 through 2025, that's June, we've been able to decrease our chronic absenteeism by almost 15%. Right now, go ahead.
That's so impressive. We're going to keep you there, and we're going to keep going and just do a quick review of the data and the statistics for each of them. So let's go to Hall County. I wanted folks to just have a quick sense of who are the communities, and that is impressive information. Thank you, Hannah. And let me go to Joey to talk to us about Hall County.
Good afternoon. I'm Joey Millwood. I'm the Director of Student Services. We are a district of 26,000 students, 35 schools, 9 of which are not Title I schools. And you can see from our demographics there, we have a high Hispanic population, high number of students who are English language learners. And with that, there are challenges. We're blessed with our diversity, but we're also, we do recognize that we have some challenges that will lead to chronic absenteeism. And so we'd like to focus on a whole child approach. If you go to the next slide, you can see from our attendance over the last 3 years, we also did not include our pandemic numbers, but we are currently below the national average over the last 3 years. We are trending downward through our efforts and our focus on trauma and mental health, behavioral health. Who Joy will go into more information there.
We'll get more into the strategies in a moment. With that, Christy, and why don't we turn off the slides for a second? Can you just tell us a little bit about the communities that Loma Linda University serves?
Yes, so we currently oversee, or I'm responsible for community academic partnerships between Loma Linda University, a local nonprofit called El Sol Neighborhood Education Center, and 2 local school districts, San Bernardino City Unified and Chaffey Joint Union. Our focus today will be San Bernardino City Unified because it is a K through 12. And our racial makeup of our students in San Bernardino is 82% Latino, so very large Latino population, also a very large immigrant population. Our next largest population is African American or Black students at 9%, and then 4% white students. And then we have small percentages of Asian, Pacific Islander, American Indian, Alaska Native, and other races of students. 91.7% of our students do receive free reduced lunch, so we have a high burden of need not only within our school districts, but just within our region in general. And our chronic absenteeism rates during the pandemic were 53%. Just last year, it was at 29%, and now it's at 23%, so a 30% decrease since the pandemic. However, we are still working to return to pre-pandemic absenteeism rates, which hovered around 18%.
Thank you. That is a really impressive reduction and still more to go, huh? With that, I would actually like to go back to you, Principal Sam. Tell us a little bit about what you're seeing as the main, in your school, health-related causes of absence. And if we could pull up the slide, that would be great.
Thank you, Hedy. So we do take a team approach when it comes to looking at our chronic absences. And so our school nurse with the attendance team, we looked at our absences. And this data is actually coming from at the end of the last school year, all our students who were chronically absent. And out of all the students who were chronically absent, the first one was general illnesses like headaches, colds here and there, everybody, coughs. And the second one is medical conditions such as asthma and diabetes. And the third one is mental health related. And so a total of 28% of our chronically absent students fall within these 3 categories.
Thank you. And Joy, tell us about what are you seeing as some of the drivers of chronic absence in Hall County?
And if you would go to our the next slide, that would be great. And this, Hedy, is taken from the Georgia Department of Education Student Health Survey that we have administered to our students, actually statewide, for a number of years. And you can see here, and several people have mentioned it, really depression, anxiety, those are high. You can see this was for 2023-24 for all middle schoolers and high schoolers. The question was asked in the past 30 days on how many days have you felt, experienced, considered, or done these things. 48% of our kids in 2023-24 said that they've experienced depression, 36% intense anxiety. And really, if you look out to the far right column, which is very, extremely concerning, is suicidal ideation in the last 12 months. That is now 8%, which is actually significantly better than the state of Georgia. And we are proud to say that even our numbers are significantly lower even than pre-pandemic numbers. So that's been something that we have worked on diligently. But that's kind of a really, really good snapshot of our 6th through 12th graders in Hall County schools.
Thank you. And so those mental health related issues, which Hannah had as third, are proving to be extremely significant in your community. And Christy, and let's turn off the slides for a second. What have you seen in San Bernardino as some of the major driver health related causes of absence?
Yes, so in our region and the specific school district, access to healthcare has been a major barrier for our families. In the state of California, in the start of the year, we were able to provide healthcare for all, but that's now being rescinded for the upcoming year. And so when families are accessing healthcare, transportation tends to be one of our major issues because we don't have the infrastructure that kind of gets people directly where they need to go. But with policy shifts with our current government and administration has also resulted in some of the fears accessing even healthcare when it's already difficult with the presence of ICE in Southern California. And so we have families who already had difficulty accessing healthcare, but now are fearful coming out of their homes for any means, whether that's to go for healthcare or to even drop off their children to school, because there have been, just this week, we had a situation where a parent was picked up. So we have students not wanting to go to school because they fear the safety of their parents, and then they fear the safety of themselves. And it's not just with our immigrant population, it's with our Latino students who are also born here, but they have community members, they have family members and friends and loved ones that have been impacted or are being impacted by our current policy shifts. So we see the ripples effects of all of this, and students are not just able to focus on school. Now they're having fear going in between schools, and then families have challenges trusting, they see something online and it's the school ICE can pick up your kid at school. Not necessarily true. We have very strong school district that stands by student rights and parent rights. But there's still a lot of uncertainty for our population, and that includes the stressors that the parents is experiencing are now the child's fears.
Christy, if you don't mind, I think I'm going to stick with you guys, to take a little facilitator's privilege to start with Christy and say, so given those things, what are some of the strategies that you're using right now to improve engagement, attendance, address some of those challenges?
Yes, so our team are trained community health workers, so I think it's a strategy in and of itself. So we took this public health model and dropped it right into education. And our community health workers are trusted leaders. And so I've heard tons of information on this webinar already about the relational aspect of what we do. Because they're trusted members, leaders, they're very visible. We provide home visitation for families, so when they can't directly receive a resource, our CHWs or our CHUs can actually take that resource over to them. And so by way of the home visitation process for us, we're able to really support school sites and the district come out of the four walls. I think most sites, or all sites that we work with, really do want to be able to meet the family where they are at. However, teachers are extremely busy, counselors, social workers, principals. It's very difficult to leave the campus with everything else that is going on. So CHUs have the unique privilege to be able to see families in their environments. And even aside from, addressing the safety situations with going to and from school for student and family, it's also just being able to see everything else that's happening with the family. So immigration and immigration reform in our country is one aspect, but when we see where folks live, maybe some of the challenges that stem, for example, we've had a family who is a migrant family, newcomers, but they live in a trailer with no access to heat or water. And mom and dad have severe health diseases that we're trying to help navigate, and son is amputated at both knees. And so it's navigating all of these concerns for the family. The CHUs have the unique ability to be able to see everything else that comes with the child, not just the child in the school setting. And so our collaborative efforts really support us. So it takes a village, working with Loma Linda's healthcare system. So we have our CHUs, But whenever we need a family that to be seen in our clinical setting, we actually have a counterpart. So a clinical CHW that gets a warm handoff from a CHU to be able to provide that navigation and support within our systems, because healthcare systems are also, I'm still figuring out how to navigate my own healthcare system. I can't imagine how it is for someone outside. And so we have these warm partnerships that are not just enveloped in the district or the school sites, but we're also working with community partners like ELSO and or others who are providing additional supports for behavioral health for students. And then especially for those social needs that often come with the health-related issue. And CHUs have the ability to also not just work with the student health concern, but the parent and or the family. So what we do discover sometimes or often is if the student's missing, so it could be a sibling has some type of, is sick or has a chronic illness, but it may be the parent that has the chronic illness and or a grandparent or a loved one who is receiving care within that home. So our role is to address the whole family. So we're looking at the whole child and that whole household to provide those supports.
So Christy, you have, I just want to make sure that if I'm recalling correctly, because we also had highlighted San Bernardino, but the Director of Family Engagement, this was on a webinar last year in the spring. Christy was actually also going to probably present, but she had the best excuse ever for not being on one of our webinars, which was that she was about to deliver a child, and so we gave her that pass. But Christy, seriously, she talked about the fact that you have high school clusters or clusters that include high school and feeder schools and family engagement teams that are assigned to each, and then your CHUs or promotores is another word I think I've seen, are actually nested as a part of that family engagement team. Is that right? Is that how this is structured?
Yes, so they're embedded. There are 72 schools within San Bernardino City Unified, and we have 7 CHUs, each one assigned to a school cluster. So there's usually around 7 to 12 schools per cluster. And their role is, their sole responsibility are those schools to provide home visitation and health education within the cluster. They oftentimes cross-collaborate because you can have one student in one cluster and the rest of the students in another because there's a high mobility or it's a transient population in San Bernardino, so we have families frequently moving. And then someone asked what a CHU stands for. It's CHEW. It's a community health and education worker. So we just added the education piece because community health workers generally lie in our healthcare system or in CBOs.
Great. So I'm going to go in reverse order. I should have given you more. Joy, can you now talk about in Hall County? You talked a lot about mental health issues. What are your strategies? Or I think it's Joy and Joey together. And I think we're going to the slides, actually, the pyramid slides, if you could. And then Principal Sam, we're going to come back. We're going to let you close up this conversation.
Joey, if you want to just do the little overview, then I'll
Sure.
get into some of the specifics.
Yeah,
We
we
bring up the slides in the meantime, too.
we approach it from a multi-tiered
Excellent.
system of support. It's very similar to RTI in the academic sense, but we have our 3 tiers, and the tier 1 is where we provide interventions for all students. That means
Hey,
everyone.
Joey, can you just hold on a second? I
Sure.
wanted to move to the next slide.
Okay, sorry.
They're showing Hannah's slide instead. Yeah, thank you. Sorry.
Okay, there we go. But you can see there, we have our multi-tiers there. Tier 1 is for all students. Where every student gets an intervention there, and Joy's going to go through these. But tier 2 is for some students, and tier 3 is just for a few or individual students. And then those are all interventions that are tailored toward their needs. And Joy can now, she can fill you in. She's the architect behind all this. So I defer to her.
And if we could go to the next slide, please. Yeah, so there down on the bottom, you can see where it says tier 1, 100%. And so that's where we have a training for all of our adults as a trauma, mental health awareness, and de-escalation skills. Where here, what we're really doing is focusing on creating school environments where students feel safe, connected, and supported, because we know that students are more likely to attend school when they feel like they belong. So specifically, all 3,700 of our staff, that's cafeteria workers, bus drivers, media clerks, parapros, everybody, participates in that 2.5 hour training that equips staff for two things: to recognize and respond. And so what are we asking them to recognize? Really, it's early signs of trauma, behavioral health challenges, and those escalating behaviors. We teach them to see indicators of when a child is kind of going up mad mountain or up frustration mountain. And then secondly, we teach them strategies to respond effectively. And then going up to tier 2, these are really a unique, it's an intervention. We call them dialectical skills groups, and that's a big fat mouthful. Really, it's just life skills that we offer to our students. We serve about 1,200 middle school and high school students a year, about 300 elementary school students in Spanish and English, and we've been doing this since 2020. So we actually did our first ones in the spring of 2020 when COVID hit. We were already had these groups in place. And so we've been tracking data showing actually pretty good growth in our pre-test and post-test. And so trained facilitators provide targeted support for students who are voluntarily seeking additional support with such things as managing their emotions, effective communication and relationships. And it gives our students a safe space to practice the skills, to get the support. And the most important thing is to build those trusting relationships with our adults as we're loving on them in the small groups, and then also with peers, which we know then the research shows reduces the chronic absenteeism.
So, Joy, can I just ask, how long have you had this in place?
Spring 2020 is when we had it in place. So it was before COVID hit. We didn't know anything about COVID when we were looking at the numbers actually for years before. And the leadership team of Hall County Schools started looking at this. Actually, in 2019 is when the large part of the trauma mental health awareness and de-escalation skills for the adults. And at the same time, the dialectical skills groups for students, which we now do for teachers, and we also do for our parents. And now in terms of combining the community and schools, there are churches that are actually doing these also in our community. And I recently have had a church ask for these in Spanish. So it's faith-based Spanish dialectical skills groups.
And so it sounds like I remember earlier when you were looking at your data, you talked about how you actually had some earlier positive results. You're already moving the needle on kid anxiety before the pandemic.
Absolutely.
And then it sounds like when the pandemic hit, having these kinds of supports in place ends up being even more essential because you can build upon that as we're now experiencing other sources of anxiety that might even be new. Thank you so much. And Hannah, let's go back a couple slides. Sorry to confuse everyone with my shifting of the order, but I would love if we can go up 2 slides to the blue slide again. Yeah. Tell us about your school at Kingsbury Elementary. How are you improving attendance with health as a focus?
Thank you, Hetty. I believe that we all agree that students have to be in school so that they're able to learn. Not just learning, because if we want to prepare students to be productive citizens, to make a difference in their society, I think it's important that it starts at the elementary level. And so for me, it's a huge responsibility to ensure that students are coming to school and we're providing them the support and resources that they need to be able to be successful. And so if we look at the general illness and medical conditions, I do have a strong relationship with our school nurse. Even what we try to do is to be proactive and not wait till the end to address issues. And so I meet with our school nurse over the summer. We look at our data as far as who was on our chronic absenteeism list. And what we do is we reach out to the parents to talk to them about what is it that we can do to support them. I collaborate with our nurse to look at the students who have illnesses and medical conditions. Do we have a doctor's medical authorization so that we're able to provide their medication to them? As, for example, their EpiPens, if we have kids who have allergies, EpiPens, diabetes, we have all that on file. While she's the professional, we as for my assistant principal and myself, we are trained to administer medication to our students. And so if the nurse is not available, we're able to provide medication to students. But that comes with, for example, educating our parents right from the get-go. And so the nurse will provide me a letter stating when to keep kids home, when to send them to school. And so it's in a newsletter. We have a weekly newsletter that I send every week. Parents are aware of what's happening. At the end of the newsletter, aside the letter that the nurse provides, there are resources in terms of transportation, community resources at the end of our newsletter so that they're able to use those resources. When it comes to mental health, I think this is a holistic approach because we cannot have kids in school if they're not happy. That's their mental health. And I think we have to look at it from that angle because it's not only diseases, but are they happy to be in school? Are they safe? Do they have trusted adults? And so for me as a principal, I think the principal sets the tone for a positive school climate. So I sat right at the gate and I was looking at the video, greeting our students by name. That has, it makes an impact on our students. And so I do that. But also our district did a great job bringing in Harvard Graduate School of Education, training administrators on school turnaround. While we're not a school turnaround, my assistant principal and I were tapped to go for the training. And part of the training was on trauma. So recognize what it is. So what we do is every year we turnkey this information to our staff so they understand what it is, how it looks like in the classroom so that they're able to support our students. So that's the tier 1 that Joy was talking about. We also have second step curriculum that teaches students about their social emotional goal setting, self-management skills. As of last year, at the end of last year, we ended. So this year we have Every Monday Matters because we believe in building the foundation for our kids because our kids don't come to school knowing everything. And so as an elementary school, that is our responsibility to train our students to be ready. And also we do at the school level, if you can see on the side, we have CDHI, that's Child Development Health Institute. This is a partnership that the school has with that organization. And so we have funding to provide resources for every classroom. That's the tier 1. And so teachers are able to support our students' mental health through every classroom has comment corners. That means seating, we have weighted blankets, different things that students can use if they need a 5 minutes calming in the classroom before it goes to a support staff. So we do have support staff, a social worker, we have the school nurse, we have school counselor, and our special education teachers. And also we have a mental health, that's basically the crisis team, but we call it mental health. So we meet every week to discuss students who needs tier 2 support and then making changes as needed. But the main point is the weekly attendance team. We meet every week. We look at not just the numbers, and I believe I heard the data, but not just looking at the data, but who are those students behind those numbers, knowing who they are, knowing who the parents are, and connecting with them. Because again, we don't want to accuse them, but we want to come as partners in this work together. And so we reach out to them. What is it that we need? And if we're not able to support at the school level, we're able to refer them. Like, for example, we have Favor Inc. They work with our parents. There's parent education. There are resources, the same as CDHI, Child Development Health Institute. They also have resources for our students and our parents. And so we have all these partnerships. And one thing I want to add is that we look at all these partnerships, but we also have to look at the curriculum. How are we engaging our students? Are they happy? The lessons that we're teaching, the units that we're teaching. And so for us as Kingsbury School, we do partner with, there's an organization called Arts for Learning, and it's called Hot Schools in Connecticut. It's higher order thinking schools. What we do is we partner with them. They work with our teachers. We have visiting artists coming in to create interdisciplinary units for our students. So there is a real world application of what they're learning in the classroom. And also we have after school programs to get kids engaged. As actually today we did get approval for us to have unified sports program for our students, elementary students. So those are the things that we do to make kids happy. For tier 3, if we're not able to support in the school, we do have these resources from the district, Wellmore Mental Health Services. We have our outpatient counseling. If we're not able to support in the school, we refer to our student, our families to these resources, urgent care, and also Wetterberg Youth Services. One thing I would like to highlight is that because sometimes at the end of by December, if kids don't have their physicals, they're excluded from coming to school. So what we do is that school nurse will send me information about community clinics, and then I'll send out to our parents in a messaging app, which is Parent Square, so they know where to sign up for. Because we know when we sign up for, we try to schedule appointment, it takes between 3 to 6 months. And so we try to get ahead of the curve and send information to our families. As a school, we also have vision screening and dental clinics in the building. There are schools that have health-based clinics. We don't have it, but we have practitioners come in, or health officials coming, like the dental health clinics and also vision, to do screening. What we also try to do in terms of educating our parents is, please make sure you're not scheduling appointments during the day. It could be in the afternoon, so the students are not missing out. And so it's about making sure that our parents feel valued, they feel welcome, so that they're able to communicate. Because it's one thing sending messages, but it's another thing getting to know who they are, getting to know them, so that they're able to open up and share the struggles that they have, so we're able to better serve them. So these are some of the things that we do. And I have a wonderful team. Everybody's willing to do whatever it takes to get our students here. I would like to share, though, that when we looked at our data, we realized that for example, when we have snow days, kids don't come to school, or half a day, early dismissals. And so what we did was try to look at our calendar and schedule events like spirit days, so that kids are excited to come to school. So this way we're able to reduce our chronic absences, and that has helped. And obviously, as a school, we're lifelong learners. So anything that we can do to improve, we're constantly on a weekly basis assessing what is going on, what is going well, what's not going well, what can we do to make a difference. And we shout kids out over the PA system, congratulations, and just so they know that we recognize them coming to school. I know they have to come to school, but it just, as kids, they love to be recognized. And so we do that to get them excited. And they know we call them by their first names, making sure we're checking in. It's all about the climate and the culture. And so we as a team work every single day to make sure that our parents feel valued, students feel valued, and working with everyone that needs to be on the team to make sure that our students are successful.
Fabulous. Thank you so much, Hannah. There are questions that are certainly piling in on multiple levels. I'm going to actually invite everyone to join, but I'm going to start with a couple for the practitioner questions. Hannah, quick, is your nurse and your counselor full-time?
Yes, they are full-time. And I do also have a nurse's aide.
Okay. And second, and who's on your attendance team?
So I do have a social worker. I have a school counselor. We have a teacher. I have my assistant principal and myself. We do not have an attendance counselor. However, we do have a district attendance counselor who provides us with resources. And if I need, I reach out to her. I have a vacancy for parent liaison, but we believe that regardless of whether we have one or not, the work still goes on, because that's part of our school improvement plan to make sure kids are coming to school. Because when we analyze our data, what we noticed was that 1 absence equals 4 points decrease in the standardized assessment. And so that's our goal. We are all, and we look at it as a puzzle, right? So one piece is out. And so everybody works hard to make sure that our kids are coming to school. I have an amazing team.
We could tell you have an amazing team and you're an amazing leader. So appreciate all that. I want to shift for a moment to Joey and Joy. There was a question about the interventions how did you choose which interventions?
And so initially, so it was based off the need. So for our students, we were looking at the data, and there were the reasons for being the emotional dysregulation might differ. It might be, poverty, grief, anger management, substance, challenges. And so initially, when we considered tier groups, we were trying to develop these different curriculums, but we went back to the research, and the research shows if you can teach universal regulation skills, they apply regardless of the reason of dysregulation. So everybody right now watching this webinar, consider for yourself if you're sad or if you're depressed or if you're anxious, the tools that you pull out of your tool belt to self-regulate are largely the same. And so we teach those skills of mindfulness, distress tolerance, emotion regulation, and relationship success to all the kids, regardless of what's going on with them. For the adults, while we chose that, it's actually, we use the same CBT, cognitive behavioral therapy, dialectical behavioral therapy, the think, feel, act cycle, the same kind of theoretical framework for our trauma mental health awareness training for all the adults. And so we have a common language. And so that was why that one was chosen for the adult team members. They're all familiar. Yes.
Yeah, so I want to invite Elliot and Beth and Kim to join, and I'm going to ask some broad questions. One is actually about if any of you have some thoughts about suggestions for highly rural schools who don't have local health departments or share school counselors or generally lack resources. Wondering if anyone has suggestions about that situation.
One strategy, and it's a great question. We see this a lot, but with today's technology, one way to approach that is to determine if telemedicine is a possibility of getting access to those health-related supports that you may not be able to bring onto campus. And that could include behavioral health supports, it could include connection with specialists, but telemedicine has been around for a long time, especially being used for behavioral health issues. And post-COVID, we're seeing it even being used more and more for additional health-related issues.
Great. And I'm actually going to, if you want to do a quick response, Beth, it looks like, and then I'm going to go.
Yeah, just really quickly to add in, just when thinking about incorporating telehealth services, same thing. I think someone noted a school physician in the chat. So thinking about school-based health centers, when there's an additional resource, like just ensuring that they're very integrated with the school and not sort of a separate add-on. But I agree with Elliot, taking advantage of the telehealth services and integrating them into the school is a great strategy for those rural environments.
By the way, I will acknowledge you mentioned the school physician, which was a question from someone here in California where we don't very much have school physicians. This is states vary a lot. Connecticut actually, well, there are some, but it's district. A lot of times districts will have a school physician, a doctor position. It's not always present. And some states actually, like Connecticut, I think there's supposed to be a doctor for every district, which is not always the case for every district. Or every state. I wanted, there's a question that someone said, we've noticed locally here in Arkansas, our students are not getting excused for them to attend mental health therapy appointments. There's a limited number of after-school appointments available, so students aren't seeking preventive care due to concerns of missed school time. What changes need to be put in place to allow students to access preventative care to ensure mental health acute issues are minimized?
I mean, I think there are a couple issues at play there. And I think, one of it is a policy issue and thinking about how we define excused and unexcused absences. That varies from state to state. It varies within, across districts. So thinking about advocating for consistent excused absences that include preventive health care. So that's one policy side, but also, thinking about the inclusion of school-based mental health services where possible. So whether that be through partnerships with telemental health providers or with community mental health providers that serve students in a building so that students are able to access mental health services during their school day.
I'm going to go to a different question. This is for you, Kim. And the question is whether folks are using chronic illness verification forms in districts. And I'll start with you on that one.
I think this is hard and an equity issue because when you require a note to come back to school, it's not reasonable that if I kept my daughter home, she just wasn't feeling well today, I'm not going to take her to a provider just because she didn't go to school. So it's an equity issue whether they have access to care, and it does not necessarily cut down on the use of, oh, my child was sick. They're sometimes it's a parent issue, sometimes it's a family issue, sometimes there's things happening outside the family's control, and requiring a provider note is not efficient or evidence-based.
Thank you.
Yeah, I just dropped a nice link into the chat written by a pediatrician on doctor's notes and emphasizing many of the points that Kim just mentioned.
This, by the way, is something that can be both a matter of local and state policy. So people really need to look at where that is to also determine where and how you can change. Often a lot of this stuff is left to local districts to decide on what the situation should be. I wanted to also there were some questions for you, Principal Sam. One was about what's really happening in your calming quarters and also your Mind Matters. So could you say a little bit more about that?
So the Every Monday Matters. It's
Every Monday Matters. Sorry, thank you.
Every Monday Matters. The social emotional health curriculum, and it outlines different units that students can learn. So it's similar to what we had as second step. So teachers are able to, so the first 15 minutes of every day, the teachers teach those lessons. As I said, kids don't come to school knowing these skills. And so it's our responsibility to make sure that we develop those skills so that they're ready to go to middle school and high school. And so while we have the master schedule, we make sure that at the beginning of every day, the teachers are dedicating time to teach those skills to students. And I can assure you that, like, for example, last year, we could see a decrease in terms of referrals, right, of student behavior, because we're teaching students those skill sets. And so that's what we're using to support students' social emotional health, because we can't expect them to know those skills, but teach them. And so that's one piece. In terms of the calming corners, it depends on some of them have seating, different seating options, not just the regular seats. We do have weighted blankets. We have fidgets in the corner so that students, if they, for any reason, they're having a moment, that they can take some time, 5 minutes at most in the corner, and then return. Because what we don't want is teachers calling support staff all the time. So we're looking at tier 1, what can you do in your own classroom to support students' mental health? One of the things we did during professional development also was looking at the difference between what constitutes a classroom management issue and what constitutes support call. And so the teachers know the difference between what I am responsible for in my classroom and when I need to call a social worker or a school counselor to support students, because we want to make sure we're tiering the supports that we provide students. So that's what those are for.
So I think there are 2 questions. We'll see if we can get them in. One, a question is about managing the sharing of information from school to school when kids move, to ensure and has anyone had strategies that's helped to address that issue?
Hetty, I can start, because it depends if it's school to school in the same district, we're able to see, we use PowerSchool. So we're able to see what's already logged in the system. If they're coming out of district, they normally send their records, including their medical files with them, and it's vice versa. If we're sending, we send that as well, so the school has that information. as well. But if need be, we will reach out to maybe the social worker, which will go to between the social worker and the social worker in the other school, so that this way there is that communication going on to support students.
I'm curious because this can vary a lot by state. What happens in Georgia?
In our district, we use Infinite Campus. We have that's our student information system, and then we also have a state information system, SLDS, that we use. But primarily when it's school to school within our district, we share that information with our counselors and our social workers, as it is, in particular if there are pressing needs that our folks need to know from school to school. So we try to keep that collaboration open.
And my last question before I turn it, if someone would like to, someone wrote about what would be your advice about dealing with school refusal when they feel like they've done everything they've possibly done to support it. Not sure what's all entailed in that, but as if you're seeing challenges with kids having school refusal, is there particular advice that you might offer?
We actually just had this conversation with our Chaffey district, because it's a high school district, and we're actually bringing in our School of Behavioral Health to help support. How do we support parents? I think what we're seeing in terms of our students is parents not wanting to give a consequence and learning what that looks like for their child, whether it's an elementary student or high school student. And we're creating worksheets and a webinar for that now for them, so that they have some strategies right out the gate by providing them this handout, and then we will work with them in a more professional capacity by having School of Behavioral Health professionals. So we have LMFT, PsyDs, social workers. We have the whole gamut of folks that can provide feedback. And then if it does need to escalate, then it's inviting folks either on school campus site to come in and provide one-on-one support and develop a plan for parent and student. But it's becoming a lot more popular, and I think tech has been kind of a major influence for a lot of our students who are refusing to go to school.
Yeah. You all, I know that we have to give the last couple minutes back over to the campaign team. Thank you. What an amazing information, inspiration-filled panel. All of you bring such passion, soul, and expertise into this work. Thank you for all you do every day to support our kids and our families. And with that, I'm going to turn it back to Michelle.
Thank you, Hetty. And I will say that you also have that passion, commitment, and soul. So thank you so much for guiding our discussion today, to the authors and to our practitioner panelists and to everyone that's joined us. Clearly, what today has shown us is that preventing health-related absences is a whole child strategy, whole family strategy that directly supports early learning and reading success. I'm really excited about this new toolkit that's coming out, and that we encourage you to share the toolkit. You'll be some of the first to hear about it, and you already have the links to how you're going to be able to get it. So please share the toolkit widely, because every day of attendance matters, and together we can help every child be healthy, present, and thriving. So on behalf of the Campaign for Grade Level Reading, thank you again to all of our panelists, to all of you for joining us. Please take a moment to complete the feedback poll, and then stay tuned for some of our upcoming Learning Tuesday sessions. So they're up there on the screen. Hope to see you at an upcoming session, and have a wonderful afternoon. Thank you, everybody.